Joining us now, Dr. Niva Lubin Johnson. It is wonderful to have you, Doctor. During his hearing, Dr. Oz dodged questions about Medicaid cuts, and this caught a lot of attention. Here's a clip.
But what I want to know, yes or no, is since you cherish Medicaid, will you agree to oppose cuts in the Medicaid program?
I cherish Medicaid, and I've worked within the Medicaid environment quite extensively, as I highlighted, practicing at Columbia University.
That's not the question, Doctor. The question is, will you oppose cuts to this program you say you cherish? Time's short.
Okay, so that, of course, caused widespread concern. How do you read it, Doctor, and what do you predict Dr. Oz will do if he does, in fact, get through?
So, thank you. First of all, thank you for having me. I'm not going to predict what he will do. I would hope that he would not have any cuts to Medicaid. Medicaid is a very necessary program in this country. More than 1/4 of the country probably is receiving Medicaid alone or Medicaid along with Medicare. And so a lot of the citizens of this country really needed to have their health care.
Yeah, well, I think many share your concerns, that is for sure. Let's turn now to this. Health and Human Services Secretary RFK Jr., he's targeting an FDA loophole this week that essentially allows big food companies to police themselves. So the decades-old GRAS policy, or generally recognized as safe, allows food companies to self-certify safety of some ingredients. So while our government doesn't do its own independent testing in many of these cases, earlier on NewsNation, an advisor to the FDA and USDA spoke about this, and here's what they said.
There is no equivalent to the GRAS program, for instance, in the European Union. There are strict compliance and testing protocols, and the transparency and the way in which companies have to go through a process to prove that their ingredients are worthy of being, considered to be their equivalent of generally regarded as safe. We just don't have that here.
So, of course, we want to ensure our food is safe. What do you make of RFK's move, and do you believe it will inch us one step closer to that goal?
I think that we need to continue all the FDA measurements in terms of keeping the food system safe. We've already seen the things that can happen with the current regulations we have when you talk about the numbers of outbreaks of illnesses we have related to produce or chickens, et cetera. And so I don't think that eliminating those regulations will help our country, and it could cause further illnesses.
All right. We've got about 30 seconds left, but I do want to get your take on this. This story's caught a lot of attention. A New York woman suing the Girl Scouts and its cookie manufacturers for $5 million, and the lawsuit claiming that the Girl Scout cookies are contaminated with dangerous heavy metals and a weed killer. So a nutritionist weighed in, and here's her explanation.
It's ending up in rainfall. They're finding it in our soil across America. They're finding it in our drinking water. So it's ending up on a lot of our foods. But unfortunately, with a lot of the ultra processed foods, it's showing up in higher numbers.
So are these metals commonly found in our foods, Doctor?
So I'm going to be honest with you. I have not heard about this case with the Girl Scouts and cookies. But I would say that, there are a lot of harms with ultra processed foods, of course. But I hope that the appropriate measures are going to be taken to make sure that these are eliminated if they are present.
Thanks so much for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.